Welcome to today's webinar with eLotus, the leading provider of acupuncture continuing education. My name is Donna Chow, your host and moderator for today's class. Before we get started with today's webinar, we have an exciting update on our website that comes after 3 years of dedicated work. Introducing the new addition to the course section at elotus.org, the LCH Auricular section. LCH is short for Dr. Li Cheng Huang, who is a renowned auricular medicine doctor known for effective treatments using just the ears. To explore this section, visit elotus.org and click Core at the top. There, you'll find the LCH Auricular section. Within it, you'll discover the overview, location, diagnosis, and treatment sections, along with nearly 200 auricular points listed alphabetically. Clicking on a point name will lead you to a photo and its description. Indicating its location and application. This provides a great opportunity to start learning auricular diagnosis. If you hold a Gold Pass, you can access the VIP sections for free, allowing you to advance in this protocol even faster. The link will be shared in the chat directly shortly. Happy exploring! Today's class, Evidence-Based Acupuncture for Neuropathy, is sponsored by Evergreen Herbs and will be presented by Dr. Scotty Hudson. This class will run from 8 a.m. to 5 p.m. Pacific Time with 4 scheduled breaks throughout the day, and lunch will be around 12 to 1 p.m. Before we dive in, let's ensure an engaging and informative session. For the chat room, kindly set your chat preference to everyone so that everyone can be part of the conversation and everyone can see what you are typing. If you do have any questions for our speaker, please type them directly into the Q&A box. Then after the webinar, a quiz will be available to you guys and it will be sent to you no later than tomorrow evening. I'll notify you personally by email, so make sure to check your email to see when you receive an email from me that the quiz is available. Our wonderful speaker today is Dr. Scotty Hudson, originally trained in anthropology with a focus on human brain development. Since obtaining his acupuncture license in 2007, he has spent 15 years researching acupuncture's mechanisms of action and building an evidence-based understanding of TCM. For the past decade, Dr. Hudson has been teaching TCM at the Florida College of Integrative Medicine and has valuable experience in outpatient psychiatry. He previously presented an evidence-based acupuncture webinar on depression in February of 2023, which you can find on our website at elotus.org. We are honored to have Dr. Hudson join us today again, so please give him a warm welcome. Dr. Hudson, please feel free to take over now and share your screen for the presentation.
All right, thank you, Donna, and thank you everyone at eLotus. Give me just a second to share. Okay, hopefully everyone can see well. Good morning, and thanks to everyone for joining in on a Sunday morning. It's still the morning here in the East Coast, a little bit early for you all in the West, but thanks again for joining in for our little talk about evidence-based acupuncture for neuropathy. And again, thanks to Lotus for hosting me again and allowing me to come back and share a little bit more of the evidence-based perspective. So we got a full day ahead of us. We'll take some breaks and hopefully won't be too tired by the end. All right, so we'll go ahead and we'll start with our learning objectives. So hopefully by the end of the seminar today, we'll have a good idea of what evidence-based medicine is and be able to explain its importance for acupuncture treatments. Any of you who might have tuned in a few months ago when I did the evidence-based acupuncture for depression seminar, that section would be very similar. It's important that we understand the evidence-based perspective and what it can do for acupuncture treatment and for our patients. And the next learning objective is to identify various types of neuropathies and understand the very basic diagnostic criteria. Neuropathy, actually, there are lots of types. and can be quite complicated, but we're going to try and boil it down to a basic kind of understanding. And after that, we need to figure out what really happens with neuropathy in the body. And so we'll hopefully understand the basic etiologies and pathogenesis of the various types of neuropathy. We'll be able to explain the basic biological mechanisms of action by which acupuncture can help alleviate neuropathic symptoms. At the end, we'll formulate an evidence-based treatment protocol using data from all of the peer-reviewed research articles that we're going to look at. And through all of this, one of the big goals is hopefully to be able to communicate effectively with the patients and conventional medical practitioners using sort of modern biomedical language. That's really important that we make the effort to come to their side when discussing patients and our treatment and what's happening. And of course, all of this you should, in the end, be able to apply to not only the treatment of your patients, but also to market your acupuncture services. So, in a little bit more detail here, the course contents. Again, we'll start off with an introduction to evidence-based practice. What is it? Why should we bother with it? Go through some definitions there. We'll try to understand the importance of research. We'll take a little bit of a look at types of research that is performed with studying acupuncture, human clinical trials, the importance of rating scales and biomarkers, and animal studies, which will figure somewhat prominently in today's seminar. In the next part, we'll try to understand neuropathy. We'll have some definitions of various types of neuropathy. We'll look at the symptoms of neuropathy, understand how the various neuropathies come about. And we'll take a little look at diagnosis from the modern biomedical perspective. And that's something that can be helpful to us. We might not be doing nerve conduction studies or anything, but certainly having a basic idea about a neurological exam oriented towards neuropathy might be helpful. So I think you'll enjoy that part. And then we'll look at the basics, right, of the pathogenesis of neuropathy. And we're going to see that there's a lot of biochemistry involved, and a lot of parts of the body all the way through the nervous system become involved. And it can be rather complicated, but we're going to try to keep it simple so that it's useful for us. And so that when we want to talk to our patients, we can have a good enough understanding that we know what's going on, but not get bogged down in too much of the molecular biochemistry and things like that. And then in the third part, and this is sort of the bulk of what we'll do today, it's the research review of different acupuncture studies for treating neuropathy. And the first section there is the mechanism of action research. And this is mostly on animal models. And we'll look at a systematic review there that just came out in May of this year. It's been circulating a little bit around social media, and it's a really dynamite one. And we'll take a look at what we can learn from that. And then we'll look at clinical trials research on different types of neuropathy. We'll do some systematic reviews there. And then we'll take a little bit deeper look at some selected studies and see if we can really get a more detailed understanding of a few aspects of how acupuncture can treat neuropathy. And from all of this research that we're going to look at, we'll be able to develop this evidence-based template. And the purpose of the template is not to pigeonhole you into certain protocols, but to provide you with an evidence-based approach that's flexible to your different patients and to their different needs, but is grounded in research and provides us with a strong basis for safety and efficacy. And then at the very end, we will apply the template to some case studies. And we've got some case studies at the end or cases I've already had that I've worked through. And if we have time today, I've got some other cases which are not in the PowerPoint that we can maybe work through together. We'll just have to see how much time we have at the end. Hopefully we have enough time for that. And then the last part is all the references. And you'll notice when we go through the PowerPoint, at the bottom of the screen, you can find a On some slides, it says reference, and then there's a number, and that corresponds to the references at the end of the PowerPoint. It's all listed out there, so you can, if you want to know more about any particular slide, you can follow the reference and go and see what else is there. Okay. All right. So we can begin with trying to get some kind of a definition of what is evidence-based practice and the evidence-based practice model. And we can keep it pretty simple here too. Just the kind of a standard definition: evidence-based practice uses current research to inform clinical decision-making and provide patients with the safest and best clinical outcome. So that's really what it's about, right? How can we get the best result for our patients? And, you know, acupuncture has been useful for thousands of years for helping people. And now, so we already know that, but now we've got this extra layer of information, which can hopefully give us even better clinical outcomes. And the safety part is important too. We'll be looking at that a little bit down the road when we look at some of the research studies. So 3 parts to the evidence-based practice model: utilization of the best available research. And this is important. I put the little asterisk by best available research because I just want us to think about the fact that some of the studies are better than others. Some of the conclusions drawn from some of the studies are, we should say, stronger than others. And we really need to use a little bit of critical thinking when we're looking at the research. It's sort of on us to say, well, what happened here? And is this actually going to be useful for us clinically? Or should we kind of let this go and look at some other stuff? And definitely we'll be doing that when we go through our research review. The other part is incorporating individual clinical experience, right? So evidence-based practice means not only the research component, but the evidence from your own clinical experience, which is really important. You know, if you've been practicing for any amount of time, you've got some experience. And what you've learned during that time period is really valuable and really helpful, and not something that you should ignore or throw away in place of some new research that's come out, right? The key is to merge everything and to synthesize it. And then the last part, and this is really, really important, but I think it's probably easy for acupuncturists and people doing Chinese medicine: consider the patient preference, right? What are their values? What are their expectations? What's their tolerance for certain types of treatments? What do they want to get out of the treatment? What is their compliance level? As acupuncturists and Chinese medicine practitioners, we think about this all the time. You know, we, from day one, probably in our class learning this beautiful medicine, we think about individualizing the treatment for the patient, right? That's one of the hallmarks of TCM, individualized patient treatment. And certainly the evidence-based practice model really wants you to include that as well. But that's easy, right? Because we already do that kind of stuff. Okay. So a few more things to think about here. Might be some additional considerations for TCM practitioners. Evidence-based practice does not replace TCM, right? It's not supposed to. We don't want the evidence-based practice to get in the way of our foundational work. We don't want it to get in the way of what we already know from thousands and hundreds of years of TCM, right? That's not the purpose of it. The purpose of it is to enhance what TCM has already created. And there's no reason why it can't. You know, I don't think the two are exclusive. I think the evidence-based research that we have now and the ancient knowledge that we inherited from all those sages hundreds and thousands of years ago, that's, you know, they go together, really. It's just up to us to put them together. So don't want there to be any ideas or thoughts about, you know, we have to kind of let go of the past or anything like that, because that's not the way it's supposed to be. It's supposed to be for us merging and a synthesis, right? Another important point for acupuncturists and TCM practitioners is that the evidence-based practice model does give us a common language to be able to speak with conventional medical practitioners and patients, right? This is really important. we go to school for years and years and years to learn what spleen qi deficiency means, to learn damp heat in the liver gallbladder, all those sophisticated patterns of identification. We learn what qi blood, yin and yang, all these fascinating terms. But the rest of the world, they didn't go to school for that. They haven't got a clue. And some of them want to learn, but a lot of them don't. And so an important component to the evidence-based practices, it helps us give us a common language, right, that we can translate what we have learned as Chinese medicine practitioners into conventional, modern biomedical terms. And this is really helpful. It's helpful when you're talking to your patients. You don't have to be complicated. You can be real simple about it. But talking about acupuncture working on the brain and the nervous system and the fascia and the muscles makes a lot more sense to them than qi stagnation or blood stasis and things like that. So it's an important one. And certainly when we're going to be speaking with conventional medical practitioners, the better we can translate our wonderful medicine into their language, the better it is for everybody. It's easier for them to understand. And then from there, the merging of Chinese medicine and acupuncture into the mainstream is going to be so much easier. So that's one of the things that I hope we get out of this seminar is it doesn't have to be real complicated, but enough of a biomedical understanding of what acupuncture can do for neuropathy so that when you go to speak to the patient or you go to speak to the conventional medical practitioner, you can put it into terms that they can understand, which really means translating out of traditional Chinese medicine and into the modern language, if you will. And then the last little bullet here, successful application of the evidence-based practice model for TCM practitioners, right? It really does require this synthesis of the ancient tradition, which is beautiful. It's wonderful. So much wisdom and knowledge in there, right? But synthesizing that and the modern, right? The modern research that we're just learning now for each individual patient. And this might be a little bit of a tall order, but if we practice it, we can do it. It's not impossible. And I put in each individual patient there because it's true, right? Not every patient is going to need quite the same mix of ancient tradition and modern research, right? We got to balance that out patient to patient. But with practice, you can do it. It's not that hard. And the little graphic that we've got here, it shows evidence-based practice, and it's got like some, why do we need it? And then why should we adopt it? And I really like the highlight here of clinician experience and patient outcomes. So not only, of course, is it going to be good for the patient and the better clinical outcome, but also for us as practitioners, it can be quite rewarding too. And of course, if it improves the cost effectiveness of what we're doing, hey, that's all the better, right? We'll take that on. All right, so we can look at this a little bit more. Why, right? Well, kind of just talked about why a little bit, but just to highlight here this idea that using newly acquired information, right? That's been a part of TCM since the beginning. And I always enjoyed reading through the Materia Medica when they'd introduce a new herb and they would talk about it. They give you the breakdown, the channels it goes into, and the organs and everything else, and the indications and the properties and actions. And then in the commentary section, usually they have quotes from different generations of practitioners and, historical record kind of. And I always liked reading those because it was fun to me to see how through time, the understanding of a given herb changed. In the beginning, it might have been good for one condition, but then a couple centuries later, someone else comes and critiques that and says, well, you missed these other things that it can do. We need to add this to it. And then a few generations later, there's another quote, well, these guys are right, but they got this wrong. And we really need to think about these other options for this herb. And that I was always like, wow, that's one of my teachers said, they never threw anything away, right? They just keep adding to it. And I look at the modern research in the same way, just keep adding to that tradition. And, I'm sure if Poitou or Sun Simiao was around right now, they'd probably be surfing the internet all night, just getting all the data they can to add to what they already knew. So, it's a good thing for us, right? And clinical practice of Chinese medicine in the United States, I think it's a lot better, actually, the last couple of years. There's a lot more interest in the current research on the mechanisms of action. When I was in school, not so much. That was not actually discussed at all, really. I think it is better now. What is it? The American Acupuncture Society of America, ASA. Yeah, right. They're doing a great job. They're always out there promoting current research and things like that. And, one other thing to think about here with the addition of new information to our tradition is the modern clinical setting. It is a little different, right, than it was 2,000 years ago. And I think neuropathy and probably depression are two topics which highlight that. Sure, there were isolated cases of these things in the past, and we've got records of that. And, maybe depression was a little more common in ancient times than neuropathy. But changes in our lifestyle over the last, 100 years have caused dramatic rise. And if we think about neuropathy specifically, there wasn't as much diabetes 2,000 years ago. There really wasn't. There wasn't any chemotherapy-induced neuropathy 2,000 years ago. There might have been some traumatic injury versions of it, but our clinical setting's a lot different. Some things are still the same, but it's a lot different. If we even think about diet and if we think about lifestyle, quite different. So adding in this new data that we've got, right, from these new studies, it really helps us sort of modernize to be appropriate for the current contemporary clinical setting. And what's that going to do, right? That's going to give us a better clinical outcome, and it's going to give us more safer treatment protocols. One other thing, which is kind of important too, and it says here, it also dispels myths and superstitions about Chinese medicine and acupuncture, which can be very detrimental to the patients and the professions. So whether it's a safety factor that maybe has something weird surrounding it, or maybe it's just the explanation of how it works, right? Can be a few different things going on here, but certainly Chinese medicine's been shrouded in lots of cloudy stuff at various times, at least here in the US. And the research really helps break up some of those clouds and let us see what is really happening here in the body. And is this really safe? Like when I was in school, I had a few people tell me, oh, you shouldn't do E-stem electroacupuncture on the head, or you have to be very careful about where you put it on the spine. And actually, it turns out now there's been lots of research those are kind of myths and superstitions, which maybe at some point was useful, but now not really, right? That would kind of hold us back. Reference back to the talk that I did in February on depression. E-stem to the head is tremendous. That's like a magic for lots of mood disorders, and for neuropathy sometimes too. We'll see some studies that look at that one as well. All right. All right, so the importance of research, we're talking about that. And we need to think about critical assessment of the studies. This is important because we can't just sort of take everything. We've got to really put on our critical thinking cap and make sure that we have a good idea about the quality of the study and what parts of it might be useful and what parts of it might not be. So the current accepted model for clinical trials, right? This is for studies with people, or any type of medical intervention, is this randomized, placebo-controlled, double-blind study, right? That's their gold standard. And that was developed to study how chemicals work on your body, how the pharmacy works on your body. This was developed to study pharmaceutical intervention. And it works great for that, because the person giving you the pill or giving you the shot doesn't have to know if the pill is real or not. They're just giving it to you. And so it could be placebo, it could be real, so they don't even know, right? And you could do the same thing with herbs if you wanted. So it would work great for that too. However, it's not a great tool for studying physical interventions, physical medicines like acupuncture, massage, physical therapy, chiropractic. These are different. And these actually require the person administering the intervention to know what the heck's going on, right? You want a good acupuncture treatment, you need to know you're doing acupuncture. And I still don't get how the double blinding concept works there. Actually, just last night, I saw an IG post about a double blind study for laser and cupping. And the laser I can understand, because maybe the laser works, maybe it doesn't. You're just sticking it on the body. But how do you not? And I was too tired. I didn't go look at the link, but I wanted to. I'll find it again later, tomorrow or whatever, and I'll look at it. How do you know if you're cupping someone or not, right? That I don't quite understand how you can blind that part. You're either putting the cup on or you're not. Same thing with acupuncture. And I mean, I guess you could give someone a chart and say, here, go put these needles in these points on this chart. And maybe they're not acupuncture points, right? But that's weird. And that's I don't know. You could still get a result, right? Because the whole body could be an acupuncture point. So don't want to go too long on this guy, but the double blinding concept is really not applicable to acupuncture because you need to communicate with your patient. You same like it was like a massage or tuina. You have to have communication with the patient in order to get a good result. That's just how it works. You know, is the patient comfortable? Are they not comfortable? Do they get a chi sensation or not? All kinds of things go into that. So that makes it hard to have to pigeonhole and to cram acupuncture into this model, this clinical trial structure, which was developed for a completely different type of intervention because a pill is not a needle, right? A pill is not a needle. And you can't expect the two to function or to be delivered in the same way, right? They might produce the same reaction in the body, but the delivery method has to be different. So that's a challenge. We'll see some studies that still are good, even without this one. But a lot of scientists and conventional medical practitioners will say, oh, well, you know, it doesn't fit the gold standard, so we're not going to pay that much attention to it. But it's a conversation you can have with them about how that doesn't really make sense for us. And then the results in the human clinical trials about the effectiveness of acupuncture often give conflicting or inconclusive results. And there's lots of reasons for this, lots of reasons. Again, acupuncture is such an individualized type of medicine, right? And this whole paradigm of research is about standardization, really. That's kind of one of the underlying fundamental components there, which acupuncture is hard to standardize, right? We were individualist for the patient, individualized treatment. However, I think there's a middle ground for that. And the template that we'll create at the end is my idea for the middle ground. But we'll still find some studies that are actually really good. And, you know, they did a good job in their design and how they chose which points and what's going on there. And as I say, there's also lots of progress that have happened over the last even 4 or 5 years, especially the last 10 years. So our takeaway from all this is in the evidence-based practice model, right, the data from clinical trials needs to be critically evaluated for usefulness, and it needs to be supplemented sometimes with the mechanism of action research on the same disorder. Because oftentimes a clinical trial might give a very nice result, but then in the conclusion, they're like, you know, we got a good result, but we really don't know what happened. We don't know how that worked. And that's where the animal models sometimes are so useful. And they really do give us a more insight into what's happening physically, biologically in the body, physiologically. And they're oftentimes more rigorous in their methodology than some of the clinical trials. It's just, I think that's a matter of logistics there. So a little bit more about the human clinical trial part. It is still impossible to double blind. I put the asterisk there just because as I say, like I've seen the one last night on cupping and laser, and then I saw one a while back and I never got to follow the reference where they claim they can do it. I need to see that in person. Improvements though have been made, right, in the placebo control. They've got all kinds of sham needles that don't really penetrate the skin, that they just kind of get taped on. And if no one's ever had acupuncture before, they don't really know what it's like anyway. If they're using electroacupuncture, a very common placebo control is to hook the machine up but not turn it on. And so, you know, the the real acupuncture gets the electrical stimulation and the placebo doesn't. Of course, just putting the needle in is a treatment, right? We know that as acupuncturists. So there's still lots of challenges with this placebo control concern. However, there is progress there, right? They're making some headway on that one. We can still use data, though, from the clinical trials, right? We have to pay attention to their methods. And sometimes a trial that didn't get a great result can still give us a lot of information about either what we should do or what we shouldn't do when treating a certain disorder. So the outcome of the trial is important. Was it successful? Did it work? Of course, we want to know that. But sometimes things in the methodology are really important and can really enlighten us a little bit clinically. Some ideas like, did they use a TCM diagnosis, or did they just go with some sort of general point protocol? Did they use a point protocol that had been used previously with good success? What was their thinking process in choosing that? What was their type of placebo or their control? And is that important? Did that, influence the outcome of the study in a weird way? We'll look at a systematic review in which the control part might be an interesting consideration for us. That'll be in a little while. And then things like, what is the treatment time? How long did they do the treatment for? And what was the frequency of the treatment, right? What was the course of the treatment? How many treatments did they do? And how frequent were they? This is really important stuff that can help us create the template at the end and help us when we're in our clinics to have a solid foundation for what to not only tell the patient, but what to do with our plan, right? And at the end of our work today, when we get to the template section, we'll see hopefully how all that comes together from the research, and it's quite useful, at least for me. And another point here, the human trials are more and more using things like MRI, biomarkers. We'll talk about biomarkers in just a minute. It could be they're checking the neurotransmitter levels or hormones or other signaling molecules to what? To objectively measure acupuncture's effects. We see this all the time in the animal studies, but the human trials are trying to add this more and more and more when they can. And the work in depression actually is pretty good now. They're really, really trying hard to objectify acupuncture's effects on humans. In the neuropathy studies that we'll look at, there's not as much yet going on. It seems like it's not quite as far along as the work on the depression, but still it's something that's coming down the road and something that will only increase our knowledge, right? And only make things better. And again, the more we can understand acupuncture's mechanisms of action, the more we can understand how it works in a modern sense, right? Then we can relay that to other practitioners and we can relay that to patients in a language that they understand. So ultimately, it helps us translate this ancient wisdom into a modern, common biomedical language, which everyone benefits from. Of course, you'll always have some patients that love to hear about, their spleen qi or their liver qi stagnation. And that's great. And we want to educate them on the ancient qualities and descriptions, and that's beautiful. But there's plenty of people that they just, please tell me something I can understand. And in my own practice, really, I 85% speak in terms of the modern biomedical common language, and maybe only 15 to maybe sometimes 20% ancient Chinese ideas. Depends on the patient, right? Depends on the patient. Okay, so rating scales. These are really useful, and the clinical trials love to use them because it's an attempt at somehow kind of objectifying what's happening with the patient and what kind of a result that we're getting from the treatment that's being tested. They're not going to use any kind of a biomarker or track the physiological change in someone in some way. Then the rating scale is really what it comes down to. And the things that we're used to, actually, right? So it's a subjective assessment of the study participant's symptoms, but they're trying to objectify that subjective feeling or sensation that the patient has. And some common ones that are very useful: the visual analog scale and the numeric rating scale. As acupuncturists, I think we're probably pretty familiar with these. Most of us use some version of this with at least some of our patients, right? They're very common. And what are we trying to do, right? With these particular ones, we're trying to assess the patient's pain severity. Some rating scales are completed by the patient and some administered by the clinician. I actually have some that I give the patient to take home throughout the week. And I think with things like neuropathy and some of the more serious pain disorders, it's pretty useful, because it can be hard for a patient to remember what happened over the course of a week, or even over the course, if you're seeing them twice a week, a few days. And giving them a take-home scale can be really useful. And then when they come back, I usually have a part in there for them to make notes on anything. If it changed a lot on one day, they can take a look, they can write down, oh, well, I mowed the lawn and this happened, or, whatever it might have been. So the rating scales help track symptom severity over time, and they're often used in a statistical analysis of the study outcomes. So that's, most of the human trials, they will want to run some pretty sophisticated statistical analysis of what's happening with various components of the study. And the rating scale is an easy way for them to convert the subjective sensations that the patient's having throughout the study into some kind of objective thing that can be analyzed. And again, they are really important when there's no direct biomarker of a condition, right? This is how they can keep track of it. And in terms of neuropathy, there's a ton of different rating scales that are sometimes used, partly because neuropathy is kind of complicated and it depends upon which type of neuropathy. So studies about diabetic neuropathy versus studies about chemotherapy-induced neuropathy versus a study about trauma-induced neuropathy, right? They might use somewhat different scales. And it's really too much for us to try to learn them all or to go through them all. It's really not necessary. However, there are a couple that are really, really common. And the visual analog scale is used a lot. Adjust the numeric rating scale, rate your pain on a level of 1 to 10 is used in almost all of them to some degree. And then this BPI, a brief pain inventory, this is a really common one as well. And we'll take a look at that in just a second, because it's one that you can use in your own clinic. It's not super complicated. It doesn't take a long time to administer or to use, and it's actually kind of nice and helpful. And some of the others, this Leeds assessment of neuropathic symptoms, we're not going to look at that too much. Neuropathic scale, pain scale, and there's some others that have to do with neurotoxicity from chemotherapy, things like that. We may see that later on. But here is one that I got from the Department of Defense. And if you like this, you can just Google Department of Defense pain visual analog scale, and you can download it. And I do see a lot of veterans in my practice and have now for quite a while. And I really like this one. This is actually a couple different types of pain scales combined. So it's got the visual part, which is the face, right? Smiley face, a little bit sad face, oh, really, really sad, uncomfortable face. It's got color component, right? Is it mild? Is it moderate? Is it all that red? We don't want to be there. It's got the numeric rating scale too, though, as well. And then it's got a little verbal description. So it's got a little verbal cognitive component to the rating of the symptom, right? Or the rating of the pain here. And I think this is a great one. I use it quite a bit. Got it hanging on the wall in treatment rooms so that if, we can just say, well, let's take a look at the scale. Where are you today? And I like it because it's got something that can appeal to anyone. Some people, they'll be more attracted to deciding by looking at the face where they are. Other people might be more attracted, or it might be easier for them to relate to the color or the number. And then some people, those things don't mean anything to them. And I've had some patients, they'll be like, oh, it's just a number. What does a number mean? Well, here's what the number means. And you can take a look at the way the descriptions are for each number, and then that can really help some people. If they're like, well, geez, I really don't know, I have a high pain tolerance or what have you. Say, well, let's take a look here. Does it distract you? But you can still do your usual activities. It's worse than that. Well, does it interrupt some activities? It's worse than that. It's hard to ignore, and you avoid your usual activities. Like, yeah, now we're getting there. Oh, and I can't even focus or concentrate and do my daily stuff. Yeah, that's where I am. And so you use what you want, but I think this one is the great one from the Department of Defense. It has the option and the ability to really kind of appeal to everyone. And here we have the BPI, the Brief Pain Inventory. And I'll kind of see if I can make this a little bigger for you to see. And actually, I will go to, we'll step out of the PowerPoint here for a minute, and I'll show you. This one's 2 pages, Brief Pain Inventory. And hopefully everyone can, I enlarged it a little bit there, can see it pretty well. But I'll kind of help you. If you're having trouble, I'll read a little bit of it here. So the first block is, throughout our lives, most of us have had pain from time to time, such as minor headache, a sprain, a toothache. Have you had pain other than these everyday kinds of pain today? And they check yes or no. And then they have the option to make a check mark or a line or a circle or put an X where the pain is on the little diagram there. And then and actually I have that little diagram on my soap note, and I let them write in, on the diagram on the soap note, they can show me exactly where they're feeling it. And then it goes down to ask a few more questions. This is on page 1. We'll look at page 2 in a second. So please rate your pain by marking the box beside the number that best describes your pain at its worst in the last 24 hours. So how has it been in the last 24 hours? They can make their check mark there with a number. Please rate your pain in the box, marking the box beside the number that best describes your pain at its least in the last 24 hours. Okay, that's important too, especially with neuropathy, because sometimes it's relatively constant, but oftentimes there's a great variability in what they feel and what they experience throughout a given day, a 24-hour period. And then the next one, please rate your pain by marking the box beside the number that best describes your pain on average. Okay, so the worst and the least in the last day, and then what's the average pain level that you experience throughout time. And then how much pain do you have exactly right now? Oops, sorry about that. Back here. All right, and I'm going to come out of here for just a second. And pull this guy back down. And then let me enlarge this for you. We're going to take a look here at page 2. And just going through this because you can download it. I put the link in there. And if you don't have a good rating scale to use for pain, or especially a patient that comes in with a neuropathic type situation, this is an easy one to download and to use. And it's short. It doesn't take forever for them to fill this out. It's not overly complicated. Some of these are complicated, but this one's not. They call it brief. That's why I like it. What treatments or medications you're receiving for your pain, put that in. And then in the last 24 hours, how much relief have the pain treatments or medications provided? And so they pick a percentage of how much relief you've received. And this is, sometimes I don't always use this form or something, but I will ask my patient, I'll say, okay, all right, so then, since the last treatment or in the last day, what percentage have you improved, or what percentage has the pain gone down? How much relief have you gotten? Well, 50%, or only 20% better. Most people can make that calculation pretty good. And then they've got some functional activity stuff. Mark the box beside the number that describes how during the past 24 hours pain has interfered with your general activity level. So does it interfere at all? Not at all? How does it interfere with your mood? And certainly with chronic pain and neuropathy, interruptions to the mood can become their own problem. right? And we'll see that. And one of the studies looked at neuropathic pain and depression. And it's really common for people who previously have been okay to develop some kind of mood disorder when they've dealt with severe pain for any extended period of time. If you've never had severe pain for more than a day or two or three, you might not know. But if you've ever had severe or debilitating pain that lasts a week, 2 weeks, 3 weeks, a month, 2 months, wow, it really takes a toll on your mind. And that's something as clinicians that we want to be aware of, and certainly that we want to help address when we're treating the pain. We can, as acupuncturists, we can do so much in one treatment, right? So we want to think about that too. And we'll include that when we get to our template, because that is a big deal, especially with neuropathy. Most neuropathy patients have some level of depression or anxiety associated with their neuropathy. Has it affected your walking ability? Can you do your normal work, either both outside the home and other types of housework and chores? Has it affected your relations with other people? Actually, chronic pain, don't want to leave the house, social activity goes down, can't do the things with other people that you used to. Has it affected your sleep and your enjoyment of life? And so this is a real common one. We'll see this guy used in a lot of the studies, and it's there. If you want it, if you feel like it would be useful for you, you should download it and take a little look. Here. Oops. All right. And if you do have questions, you can go ahead and type them in the Q&A, and I will get to them on the break and then try to answer as many of them as I can. So feel free to type them in when you want to. So those are two simple rating scales that are used in most of the clinical trials that we're going to look at. The BPI, brief pain inventory, is used in not all of them, but a lot of them. And some version of either the numeric rating scale or the visual analog is also used in a lot. And certainly I think these are two that can be really helpful for us, can be really, really nice. Okay, so biomarkers. What the heck is a biomarker? Well, look at our definition here. Biomarker is an objective measure of what's going on inside an organism at a given moment, right? It's a marker of the biological process. And some simple ones that we probably do as acupuncturists all the time. If you check the blood pressure when your patient comes in, if you check their temperature, if you check their respiration rate, if you check their pulse rate, if you check their pulse oximeter, the oxygen saturation, those are all biomarkers. And what do we use those for? Well, we look at our little biomarker category graphic. We use them for safety, right? If somebody's blood pressure is sky high or super low, could be a red flag. They're having other symptoms that go with it. If they're elderly or they've had COPD or asthma and their oxygen is really low, that could be important. If their pulse rate's really off the chart, that could be important. So these, these biomarkers can be used for all kinds of things, and in a very simple vital signs way. We use them, I think, as acupuncturists pretty frequently in terms of safety. I like this little graphic because it kind of shows all the different areas that it can be used. Certainly, sometimes they're diagnostic, or they're used to calculate susceptibility or risk. So we can think about blood sugar, right, your blood glucose level. If it's elevated, or if your blood pressure is elevated, they may say, well, you're at risk for developing diabetes, or you're pre-hypertensive, or at risk for hypertension. Diagnostic, they're certainly used for that sometimes. Your hematocrit is very low, right, on your blood test. Then it might be, well, you're looking like you're anemic. And, they can also show us response to treatment. So blood sugar sky high. Okay, I regulate my diet and I start getting exercise, and now my blood sugar is back in line. So that was a good response, right, to the treatment. So extremely useful. And in Chinese medicine and acupuncture terms, the more we can start to incorporate this stuff, the better it helps with us merging to the mainstream, right? It's really helpful to get us in gear with how modern healthcare is. It's a good thing. It's not something that should be ignored. So as it says here, vital signs taken in the physician's office, right? Simple biomarkers of general health. In terms of research and studies, right, these biomarkers are very useful for outlining and identifying what acupuncture is really doing in the body. And it can be really complicated, or it can be pretty simple sometimes. The neuropathy biomarkers are, wow, there are a ton of them because there's so many types of neuropathy, and neuropathy involves dysfunction at so many physiological levels in so many places in the nervous system that it can be quite complicated. And we're going to get a taste of it, but we don't need to get too bogged down in it today. Of course, you've got all the references if you really want to go and study the sodium and potassium and ion channels in the nerve and what's happening there with different types of neuropathy and what's happening there with acupuncture. That's great. We're going to try to have a big picture look so that we don't lose sight of the real important thing, which is, how to make this stuff clinically useful for us on the everyday basis, right? All right, so the animal studies, they're really useful, especially for acupuncture, really useful because, as we talked about a little bit, the human clinical trials sometimes, well, they can be a little challenging, right? With animals, we can do lots of things. And, hey, I'm not happy that these poor mice and rats and other beautiful creatures are going through this, but the models are already there. They're already being used. And if we can get something valuable out of it, great. And, I will say at least, a certain segment of them, they get a lot of acupuncture treatment. So ethics of this aside, it does happen. People are doing it, and we should not let it be in vain. And we can make use of it. And at least they serve some noble existence. We can make sure that it's not just in vain. So it's really, I was surprised when I first started doing all this kind of research a while back. They've got an animal model, right? Preclinical animal model for any kind of disorder that you can imagine, because all of the medications that we take for, I'm talking about pharmaceutical things, for whatever disorder, blood pressure or diabetes or pain or anything, they were originally studied on an animal before they went to the human clinical trial, right? That's the research process. Someone comes up with an idea about a treatment. Okay, we need to test it before we give it to a person. So we're going to test it on mice or rats, at least in the beginning, usually. And so we need to figure out how to give the animal the problem that we want to test the medicine on. And so they've got them for everything. You name it, hypertension, diabetes. We'll see the ones for neuropathy here coming up in a minute, but it's really kind of mind-blowing. They've got rats that they have bred that at 180 days of life, they spontaneously develop hypertension. So that's like a genetic thing that they created inside the rat. And then they've got lots of other ways that they can induce hypertension, like put a clip on the renal artery, give them certain medication, all kinds of different ways. And so we're going to see a lot of these different animal models with the neuropathy. Like I say, ethics aside, let's make sure that that it was a noble process and that we can get something useful out of it, right? One of the reasons why these things are so important is we do get a chance to really use a more in-depth and invasive methodology. We can get a deeper look, right, physiologically and biologically at what is happening in terms of both identifying and tracking the biomarkers. As I say, there are standard models for most of the disorders. And I've got my little thing here. Let me see if I can enlarge this for you all. And so this one that I have the picture of here is sometimes kind of hard to find the pictures, but I found one and I wanted to include it so you could kind of get a look at like what it is. How do they really do it? Yes, they really do acupuncture to these little ones. This particular study, and you've got the reference down there, I wish I could get the whole study. All I could get was a short description, a little more than an abstract. It wasn't fully available for, you couldn't get the full study for public use. You had to pay for that one. I don't have unlimited resources, so I didn't. But anyway, this is a spinal cord injury model, and they wanted to test acupuncture and its ability to help the animal recover from spinal cord injury. And it's a lower limb issue. They transected the spinal cord somewhere in a lower lumbar, I believe. And then, of course, they checked, and yes, the animal had paralysis, motor dysfunction in the lower limbs. And so then they would say, all right, let's try acupuncture and see if it can help. And it did, actually. It really did. And what they did here, you see it's got this little sleeve that it wears. And of course, they habituate them to these before the experiment starts, so it's not really foreign or weird. And if you can see the little sleeve here, it's holding the head down with the little, like the little pillow thing there, and a little clip around these poles. And in the rear, it doesn't have a lot of motor function, so they didn't need to do anything there. And then the acupuncture is pretty interesting. They did acupuncture at DO4 and at DO14. So kind of light up the whole spinal cord there and give it regular daily treatment and see what happens. And it did improve, actually. And, there's several, it's not just one. They've got many specimens that they're working on there, lots of mice. And it was effective, and it did help. I think it was 2 hertz that they were applying there. And you can see the little Easton machine down here, that Hans 200. That's a famous one used in China. Fishung Han is the guy who's kind of invented this machine. He's a great grandfather of acupuncture research in the molecular mechanisms of acupuncture, and everything everybody does today is kind of standing on his shoulders. He's interesting guy. We'll talk about that another time. But anyway, just wanted you guys to see what it looks like, when they're conducting these. And we may have couple other graphics that we look at later on, and from 1 or 2 of the studies. They don't always give you this level of information about, what does it really look like? How do they really do this? But usually they give you a verbal description of how the animals are handled, whether or not they're, what's the right word? Whether or not they're held immobilized, or whether they're allowed to move around more. So this one's somewhat immobile, but again, the lower limbs were damaged from the spinal cord injury, so didn't have to really worry about that part. So thinking about a neuropathy specifically, there are a lot of animal models for neuropathy, a ton. Because there's so much neuropathy going around now, and there's different versions of it, of what causes the neuropathy, right? And so this CCI, chronic constrictive injury, that is very common. And that is where you've got the little graphic over here. You can see how they talk about tight ligatures around L5, L6 spinal nerves, right? That would be an example of the chronic constrictive injury. They tie a monofilament or surgical thread or something around a nerve, compress it, and then that causes the dysfunction, right? That induces the neuropathic symptoms in the specimen. The spared nerve injury, a lot of times they will just make a cut or damage the nerve, but not destroy it completely. Spinal nerve ligation, so sometimes it's this one right here, right? Chronic constrictive, there's several versions of it. And we can see, actually, let me see if I can highlight this a little bit and we can take a better look here, right? So we've got the spinal cord, and you see L6, the rats and the mice, they have a 6th lumbar vertebrae, a little different from us. And so they've got the extra spinal nerve there. So sometimes they'll tie the ligature around one of those. Sometimes they'll do it further out. So we've got the sciatic nerve coming down here, and we'll see a lot of the studies for the neuropathy in the lower limb. They like to do something, manipulate the sciatic nerve in some way, and tying some ligatures around there is a common one. Sometimes they will actually transect, they'll cut, make a complete break there in the sciatic nerve. That's a common one. And not too much in the studies that we'll look at, but in some other ones, they will do it further down along the nerve pathway. So we can think about, you've got spinal cord, you've got the nerve roots that come out, and then they form various other nerves of the body, right? And in case of the mice and the rats, L4, L5, L6 all come down to form the sciatic nerve. And then from there, it comes down to get the perineal nerve and the tibial nerve and a sural nerve. And this, outside of the L6 part, really follows our anatomy pretty closely too. Very similar there. So I just wanted you to have a picture. I think we'll see this again later as a reminder when we look at some of the studies of how do they actually induce the neuropathy for the animals, right? How do they make this happen? So this would be traumatic injury, right? This would be neuropathy due to some kind of trauma to the body. Could be post-surgical. We'll find that that's a very common version of neuropathy, post-surgical. Could be a car accident, could be veterans, who knows, right? They get all kinds of neuropathy from traumatic things, not just from bombs blowing up or getting shot or stabbed, but oftentimes their training is so intense that they will develop some kind of a trauma injury to the nerve that then causes them a neuropathic pain situation. The other two most common types that we'll find in the animal models and that we'll see in our studies that we'll look at today, chemotherapy, right? Chemotherapy-induced neuropathy is common. I think it's something like 33%, 34, 5% of the folks who go through chemotherapy wind up with some kind of neuropathy. And so they will give the test subject, the animal, the actual neuropathy, or the actual chemotherapy drug. And then they'll wait X number of days, and then they will check for neuropathy. And we'll see how they do that here in a few minutes, and find out what happens and whether or not they've got neuropathic symptoms, et cetera. And then they'll try the treatments, right? And then the other one, this streptozotocin, STZ injection for painful diabetic neuropathy. So the rats get injected, or the mice, or whichever other animal, with this STZ stuff, and it induces diabetic neuropathy. How does it do that? It's kind of interesting. So this STZ is a compound that is derived from Streptomyces acromogenes, a bacteria. So they go to that bacteria and they derive this compound from it. And actually, this is actually a chemotherapy drug for the treatment of pancreatic cancer. And what this chemical compound does is it kills the beta cells in the pancreas. And so if somebody has pancreatic cancer, they will give them this. It will start killing all the cells in the pancreas and kill the cancer cells. And hopefully, though, the patient can survive, right? Pancreatic cancer is one of those ones that, that's a toughie. And the medicine here is pretty intense too. But if you give it to a normal person or a normal rat who's got a healthy functioning pancreas, what's going to happen is it's going to go in and kill all their beta cells. And then what's going to happen? They're going to develop what? A problem with their insulin production. And then they're going to develop hyperglycemia, and then they're going to develop diabetes. So that's, sometimes it's kind of quite involved, the methods that they go through to get these animal models, but it works, right? And then it can mimic, of course, it's not 100% perfect, but it can mimic the disorders sometimes quite well, All right. I think we'll be, it's been about an hour. We'll maybe be due for a break here before too long, but let's see. What's the next one? Yeah, we'll go ahead and we'll talk about this slide a little bit, and then maybe we'll take a short break. So this graphic comes from a study that is looking at pain, chronic pain, and psychiatric disorders. And I already said a little bit about the common comorbidity of depression and anxiety with neuropathic pain and chronic pain in general. It's super common. And so now, even from the psychiatry side, they're starting to study this phenomenon and what's going on. And excuse me, this graphic comes from an article that was looking at the usefulness of animal studies and trying to kind of figure out what's happening in the body, not just from the pain side, but from the psychiatric, the mental side that affects people when they're having chronic pain. And I wanted to put this in here because it's the best I've ever seen of something that kind of brings all the different things that are happening during one of these animal studies together. And let me see if I can enlarge some of this and we'll take a little look. And so here they've got the pain models, and they've labeled them the different ways. And this is a little different. This wasn't just neuropathy. This was just chronic pain. So you've got the nerve injuries, right? And they've got a nice little picture there, number one. And that's what we've just kind of looked at the other graphic about. It's pretty much very similar stuff. They can induce the chronic pain, number two, by injection of chemical irritant, okay? Number three, transgenic animals, so some kind of genetic manipulation or manipulation with the mRNA inside the cells to cause the pain to develop without some other outside cause. And then they also might give them some pharmacological agent to induce the chronic pain. But remember, this study was just generalized chronic pain. But it's similar ideas for what we'll be looking at with the neuropathy studies. Bring this over a little bit here. So, once then they have performed whatever they're performing to initiate the chronic pain, or in our case, the neuropathy situation, then they need to test, is the animal really having those painful or neuropathic symptoms? And this covers pretty much everything that we'll see in our studies. So it's a good idea for us to start to get familiar with it a little bit. And the first one, they'll check the mechanical stimulus, right? Mechanical stimuli. They'll check if the animal is become hypersensitive or if it has become sensitive to something which should not be painful. And that's a common neuropathy problem, right? The non-painful stimulus causes you great pain. We'll look at this in more detail later, but to get the idea about the testing process with these studies, this Von Frey, it's called the Von Frey filament or a Von Frey hair. And you see it's this little probe type thing. And on the end of it, you can't really see it here. It's just a little light hair. It's a filament or a little, piece of like wire, but it's super soft. Super soft. If you rub it against yourself, it kind of just feels like a hair rubbing against you, which in a normal situation, a normal nerve situation, is not painful at all. But here, when they rub it, if you've got the neuropathic problem or some other pain problem, which has caused a nerve disruption, nerve function disruption, it will elicit a strong pain reaction. So like being touched with a hair, it's killing me, what's going on? And they can test that by how the animal withdraws its paw from the painful stimulus, or if its body moves in a certain way, exaggerated movement, or certain things with the tail flick. They like to check the tail flick as well. So that's one way. Another mechanical one, they may apply some pressure to the paw at various degrees, which might not normally cause pain, just like a gentle pressure, but they have a heightened reaction. Or they might give a slight painful pressure, but then the reaction's extreme, right? And the cold plate and hot plate, so they're thermal, right? Cold sensing receptors in the nerves and heat sensing receptors in the nerves are being tested here. And this is very common, and we'll see some that use this. Some check both, some just check one. Acetone, I'm not too familiar with that one. It says thermal stimuli, so it must produce a cool or a burn sensation that the animal would respond to. And then the tail flick, they will change the temperature of the little plate there and see how much change is necessary for a change in the animal's behavior. Okay, so these are all looking at testing the nerve function of the animals, testing whether or not the mechanoreceptors are working, testing whether or not the thermal receptors are working, and testing whether or not maybe the nociceptive receptors, the ones that are supposed to normally transmit pain, are doing what they're supposed to. So that's nerve evaluation, kind of. And then it says down here, affective evaluation. So these are little tests that they do with the mice and the rats to sort of measure how their emotions are. And so, for example, in this open field test, they'll put the mouse in there, and under normal circumstances, they have like a certain way that they'll explore a new area where they've never been. However, if they've got depression or anxiety, it changes the way they would explore. They're not as exploratory, and they do things with timing and distance that they move, and it's all very sophisticated. But we don't need that kind of detail yet for our understanding. But that's a common one to test whether or not the animal feels depression, anxiety, high stress kind of mental state. Forced swim test is another popular one. They'll force it to swim, and then it's how it performs and what it does oftentimes is an indicator of what's going on mentally. Sucrose preference, do they want to drink sugar water or not? That's a common one with depression, where if you're in severe depressive state, you have no, they call it anhedonia, right? No ability to feel pleasure or no desire even for pleasure. And so they won't even bother to drink the sugar water. And then down at the bottom, right, they've got some what they call cognitive evaluation. And how is it affecting their thinking, kind of, in little tests that they'll run, and then non-emotional sort of cognitive function, the water maze, they have them swim around, or what they do with new objects, right? And again, we don't need to understand the absolute details of all these too much, but I want you to have an idea of how do they figure this stuff out, right? How do they figure this from the animal models? And it's actually pretty sophisticated. And they, of course, they do a good job of making sure that the animals have, been through these types of things when they're not sick, usually, right? When they haven't induced the pain model yet. So it's not all foreign to them necessarily, unless that's the design of like the novel object or something like that. So I want us to have this kind of idea about these, because it's really important. And we're gonna see. We won't go into it in detail with the animal studies, but we'll see they'll refer to Von Frey, or they'll refer to cold plate or hot plate or something like that. And then it's good for us to know what exactly is going on there. All right, let's see. Yeah, we'll do this one more slide, and then we'll take a little break. Okay, so here, the research that we're going to look at, right? These are studies looking at acupuncture's effect on treating various types of neuropathy. The human clinical trials, they'll use rating scales. I don't think we have any that use a biomarker. We might have one. I don't think so. I don't remember that. And then the preclinical animal model studies, right? They'll be using more of the biomarkers, and then those behavioral sorts of studies that were behavioral tests that we just saw on the previous slide. It's important to note, right? Neuropathy disorders, they are complicated, and they're really only partially understood in terms of the neurobiology, and partially complicated because there's different types of neuropathy, and partially complicated because so many things change, whether it's at the receptors at the end of the nerve where there's damage perhaps, or somewhere along the peripheral nerve pathway, or at the spinal cord, or up in the brain, right? Everywhere along there, there's all kinds of things that are changing. And so there's a lot going on. And like it says here, we're going to do our best to kind of step back and take a big picture perspective. And from there, right, get this view that's useful for us clinically and not overburdened by too much molecular details. And we're also gonna take a look at what's most well studied, and that those will be the things that were most looked at in the research. And we'll find that they're all quite variable in their methods and in their results. I will say the animal models are variable, but their results are really consistent. And the human trials are where we get more variability in the results. So, yeah. And then despite these challenges though, right, there is some outstanding research and some really cool stuff looking at how acupuncture can help treat neuropathy symptoms and give us a guide when we're in the clinic, right? Give us a starting place when we're in the clinic to to work from that's grounded in some reasonable evidence, and we know it's safe and it works. And it might not work every time, but at least it's a solid starting place. So, okay, all right. So we should probably take a little break. We've been going about an hour and 15 minutes, so we can take a break now, and we can come back in about 10 minutes. So take a little break. I'll stop my share, and then maybe Donna has some thoughts for you. If not, I will see you all in about 10 minutes.